Welcome, I'm Steve Adubato. It is our honor and pleasure to welcome back once again. It's been a long time. We have him back, Dr. Shamkant Mulgaonkar, and he is the chief of the Renal and Pancreas Division for Saint Barnabas Medical Center at RWJBarnabas Health. Good to see you, Dr. Mulgaonkar.
Nice to see you, Steve.
Yeah, let's talk. We've had conversations before about kidney disease and about the kidney transplant process, but I want to put this in perspective. How many people are waiting, if you will, for a kidney transplant in New Jersey and nationally?
So nationally, we call it a tragedy because there are over 100,000 people waiting for kidney transplant alone. And approximately 350,000 or more people are already on dialysis. And we estimate close to 500,000 people are probably suffering from chronic kidney disease who will eventually need dialysis or transplant. In New Jersey at this time, approximately 4,000 people are waiting, about 2,500 people are active on the kidney transplant list and desperately looking for kidney transplant.
How long do they wait?
Average is about 3 to 5 years in the United States. Some circumstances where the blood type is unusual, like a blood type B, patients wait longer, 5 to 7 years. That's pretty long wait. To fully disclose, I know this process a little too well, not in a bad way, but my wife is a kidney donor, and she did it out of your very fine operation, so I know your team quite well. Let me ask you this. The surgery itself, I remember it. I didn't go through it, my wife did, but we talked about it extensively. Describe it. So the process of living donation is fairly straightforward for most people. The major thing is you have to come forward to donate. You have to be willing to do that. You have to be willing to help others. And then the testing is very complete. I call it presidential testing. We do everything a U.S. president would go through in order to clear the donor. They have to be willing, they have to be perfectly healthy, and they have to have 2 normal kidneys to be donors. The surgical process is very standard since 1998, especially at Saint Barnabas Medical Center and Robert Wood Johnson. It is all done laparoscopically using cameras. And we call it minimally invasive because there's not much use of knife involved. We use something called harmonic scalpel. So the patients recover much faster. Prior to 1998, Steve, the incision was pretty large. It was under your rib. It was like a shark bite. We removed the rib. It was terrible for living donors. Recovery was very prolonged.
98 and before?
Before 1998. So now patients recover much quicker. They're in the hospital. Most of them go home next day. Some stay a couple of days. And majority of our donors are able to drive a car by day 7 to 10. And if you are in a business where you just use a computer or phone, you can return to work fairly quickly within 2 to 3 weeks.
Doctor, talk about the most important and exciting developments that are going on in your field right now.
Well, so currently what we are dealing with is organ shortage. So shortage. So there are not that many deceased donor kidneys that have become available for all these hundreds of thousands of people who are waiting. So we have to be innovative in era of organ shortage so our patients don't die because of lack of kidney transplant. When you go on dialysis, your life expectancy shortens significantly as a result of kidney disease and dialysis itself, and dialysis changes your quality of life. So what we are doing is trying to use the number of kidneys that become available to us to benefit more people. For example, in a living donor situation, if I have an altruistic donor, a wonderful person who just has no business coming to a hospital and saying, take my kidney, give it to someone. But these are people who are altruistic. They are angels on this planet. So that person's blood type, let's say, is O, which is a universal donor. That individual can help another person who may have a living donor that is not compatible. So you give that kidney to the person that she matches or he matches, and that person's donor gives to someone else. So you create a chain, and therefore one altruistic donor can help many, many people. We just did a chain of 5 because of an altruistic donor last week. Chain of 5.
Just last week?
Last week.
Because of one person?
One person. So she saved so many lives because it doubles your lifespan transplant. So think about 5 people getting that many years to live, changing their life.
So that is a big innovation. The other thing is very interesting. So we're all generous people in this country. We don't like people suffering. So when you have a person who's compatible to you, let's say I'm compatible to you, but I'm much older than you, and you need a younger kidney, we approach that compatible pair and say, would you like to help other person? In return, you'll get a younger kidney. So my older kidney goes to a slightly older person, and you get a younger kidney in that process. That is called compatible share.
Compatible share.
Many people are willing to share their loved one's kidney in return for maybe some advantage. Some people say, don't need an advantage. Give me the same, but as long as I can help more people.
And that wasn't happening 20 years ago?
No, this is a fairly new approach to living kidney donation to benefit more people who have living donors but are not compatible.
But by the way, what's the name? What's the institute you have?
We have a Living Donor Institute. Interestingly, that was the first Living Donor Institute in the country. And we formed it at Saint Barnabas Medical Center several years ago. And what it did was it focused all of our energies into learning about how to do different things that would help our patients who would have alternative programs for living donation to help more people. And it has really done a phenomenal job. Just to give you an example, last year we did 301 kidney transplants at Saint Barnabas. That's one of the largest kidney transplant program in US. And if you combine the Robert Wood Johnson kidney transplant program that's part of our system, we are capable of doing almost 400 kidney transplants. That's huge for our patients. So the Living Donor Institute has allowed us to look at all these alternative programs, such as altruistic donors, compatible share, a few things I mentioned to you. And it's also allowing us to do a lot of research, innovative things that would help our patients live longer. It would help them to quickly rehabilitate. And also, there are many donors who are out of state. So how do you get an out-of-state donor to complete their testing, come to us, and end up donating and going back home?
Finally, you're wearing a pin that is connected to the sharing network, folks that we do a lot of work with that you know very well, New Jersey Sharing Network. I don't know if we can put up their site, New Jersey Sharing Network. They advocate, they work, they educate folks to donate. Why should someone donate the organ?
Well, philosophically, you can remove other constraints such as religious constraints sometimes, or your own personal beliefs, and think about someone who's dying because you did not donate your loved one's organs, or if you're a living donor, you didn't go forward, at least with education to see if you're a potential willing donor. So when you donate an organ or multiple organs from a living donor or a deceased donor, depending on what the situation is, you can save multiple lives. So if your loved one has had a major car accident and had irreversible brain damage, and you have the opportunity to help people, you can help multiple people. Just to give you an example, corneas for 2 blind people who could see because you gave corneas, heart transplant. Heart transplant is a magical treatment. Someone who's going to die next day gets a heart transplant, can live many, many years. Highly successful procedure. Liver transplant, 2 kidneys, 2 patients can come off dialysis, live normal life. And then a lot of tissues, bones,
organ and
skins,
tissue.
Incredible. So I think we have to understand that many people have done this. This is not a new thing. Our society is the most altruistic society.
And the need is great. And the the tagline for the sharing network is the gift of life.
Correct.
And it's well said. Doctor, thank you for everything you do.
Thank
we appreciate
you.
it.
Thank you very much.
Stay with us. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, New Jersey Council of County Colleges, New Jersey Resources, Create, the law firm of Gibbons PC, the New Jersey Office of the Insurance Fraud Prosecutor, and by Fedway Associates. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.